think we are thoroughly prepared. And incidentally, you must have appreciated that we started taking all possible precautions and steps much before even the World Health Organization. The whole story started in January. The World Health Organization declared it as an international emergency only towards the end of the month. That was probably on 30th or so. But we had started all our precautions and screening and everything possible that we should have done on 17th of January itself, issuing advisories to the states, issuing advisories to the passengers, travelers going to China or likely to come back from China, and also starting screening at all the major airports. We started that after 17th of January itself. And today I can very proudly say that we have screened over 2.5 lakh passengers, screened over 2,000 passengers from over 2,000 flights at all the major seaports and minor seaports. That number is also over 70, 80 seaports. We are doing screening there. The day we saw a case emerging in Nepal, immediately we started screening at all the borders with UP, Uttarakhand for Nepal, with Bihar, Bengal and Sikkim, etc. So I can very proudly say, because the whole thing is being so acutely monitored by the highest level in the country, the Prime Minister, the Prime Minister's office, the Cabinet Secretary doing all the meetings and video conferencings with the Chief Secretaries, with all his all other related ministries like External Affairs, Home, Defense, Shipping, Pharmaceuticals, and in fact all related ministries, Home Ministry. So that's being done at that level. At our level, we are coordinating with the whole country, the health secretaries, the union health secretaries, coordinating with all the secretaries of all the other departments in the government. The Prime Minister made a group of ministers committee with me as the chairman and the other my distinguished colleagues there on that committee. They are also monitoring everything. So I think we have done our best, and we, in spite of the fact that we monitored over 2.5 lakh passengers at the airports and other places, we just had only 3 positive cases. These 3 positive cases in Kerala, they have in fact now 2 have already turned out to be negative. 1 has been discharged. Another 2 will also be discharged as soon as they after having followed the required protocols. We have from starting from 7 airports at Delhi, Mumbai, Calcutta, Hyderabad, Bangalore and Chennai and Kochi. We are now doing this screening at 21 airports, screening all passengers coming from China and Hong Kong and other places like now Japan, Korea, Thailand, Singapore. So all that is theoretically possible. We started with NIV Pune. Now we have almost 11, 12 laboratories which are doing, 14 laboratories which are doing the testing, and we have the capacity to ensure that we can even get it done in 50 labs in the country, virology labs, as and when it is needed. We banned the export of all the personal protective equipments and N95 masks, ensured that we have them in ample quantities all over the country. We instructed the states. We alerted, and now with the help of a very robust integrated disease surveillance system that we have in this country, we are in fact keeping a very close watch on the activities of over 15,000 people in the country. That's not a small thing. If you look at the history of these 3 patients and see how closely we have monitored their contact tracing. So in one case we traced almost 162 contacts and tested all of them. In another case, we must have traced almost 90 contacts and tested all of them. So we are taking, you see, extreme precautions, and I'm quite hopeful that the type of support that we are getting from all possible quarters, all ministries, all the state governments, and more particularly the Kerala government has been. I am in regular touch with the Kerala Health Minister. My officers are also in touch with her. I am regularly in touch with the World Health Organization, the DG WHO, the Regional Director WHO. So I think we are well prepared, and since the whole thing is being monitored at the highest level, and there is a sense of giving cooperation to each other in the best possible manner, I can only pray to God, and of course I'm sure that the country will do well not to have this corona outbreak in such a big way as unfortunately is happening in China.
So, but talking about the vaccination, we understand that Department of Biotechnology will partner with Norwegian-based organization to develop the vaccine. But how are we furthering the preventive measures?
You see, I think vaccine is something that you can't have immediately for anything. A vaccine, development of a vaccine for a particular, you see, pathogen, it's a long effort. It's an effort which takes years for a vaccine to develop. So it will not be worth talking about the vaccine development right at this stage. But of course, we have to take the precautions, and as I said, we are doing all this screening, and the quarantine is being done even for those who are not having any doubtful history but who have a travel history. We have said that you can ensure that you have a home quarantine for 28 days. So for guidelines for that have also been issued, and all those who have a history, travel history, and then their personal history which is being taken in the during the flight also, and all those who have some symptoms or something. So we are in fact not, even if somebody is not so significantly, you see, in thermal screening, if we don't find him positive, but if there is any pointer in the history, we are screening, we are in fact monitoring the, you can say, movement of that person and tracing him to the last point. So this is about the precautions, but the otherwise there are general precautions. If somebody has, you can say, upper respiratory symptoms, he has fever, sore throat, common cold or respiratory distress, etc. And if he has some sort of history related to some contact with someone who could have been a traveler to China in the recent weeks, say for example in January or this month, then he has to get himself examined. We have instructed all the hospitals in the country through the state governments to have isolation beds also. All these labs have been developed. So the biggest thing is that we don't have to spread unnecessary panic about the whole thing. Give adequate information, give the right information, and if you have any doubts about anything, if you want to inform about anything, we have a call center which has been established. You see, already we have received, I think, over 4,000 calls in the last couple of weeks, and out of which, interestingly, over I would say around 400 calls are from people who reside in countries outside India. We have received over 200 emails, etc. So we are sharing every bit of information and every bit of you can say knowledge about the disease or what is actually happening either in China or here. Through all possible ways, we are sharing everything with the media, through WhatsApp groups, through social media, through PIB. In all the regional languages, we have made IEC material. We have transferred them to the states. On all the airports, we have put up big, you can say, informative materials, hoardings, etc., so that everybody is taught about it. Media also, we would like that you should also disseminate the right information to the people of India, so that nobody is unnecessarily frightened about the whole disease. Fortunately, the disease has a very low mortality, but that's just about 2%. But unfortunately, it has a very high, you can say, infectivity rate. So it can go very fast, and then it goes through droplets, aerosols, etc. So we have to take the routine precautions whenever we are in doubt about using masks, etc.
So you're also a doctor, besides of course being the health minister of the country. You've talked about the precautions. What are the precautions that individuals can take?
You see, individuals as such, unless you have any specific, I think the best in such situations, although there is not an epidemic of any nature in the country except those 3 positive cases, but whatever we are doing is as a matter of abundant precautions that we are doing. But even then, it is good if we avoid crowded places. If we have a history of contact with someone who is suspicious, who has a history of travel to that place, so we can then take some more precautions, inform the system, precautions related to personal hygiene, etiquettes and all that while talking, while behaving in the society. That's the whole general thing. And if you are symptomatic, you have to contact the doctor, you have to contact the health system, and if necessary and advised, then testing etc. has to be done. But this is something which is specifically happening if there is a contact with someone who has a history of being in China or travel there, and then if he's positive or in that incubation period of 2 weeks, then only it's required. Otherwise, there is no cause for any panic at all.
So, of course, there's no cause of panic, but talking about the masks, the N95 masks, of course, India has extended the helping hand to China, revoked the export ban of N95 masks. Retailers are scrambling to stock up these masks. Are we ready to deal if there's any shortage?
I think the government has taken enough precautions. We have ensured that we have a good amount of masks also. We have instructed the states also to procure them. We have all those personal protective equipments also. And today morning itself, in the group of ministers, our Minister for Pharmaceuticals informed us that they have got enough stocks of drugs and necessary medicines for next 3 months. They have ensured everything. They have taken preemptive precautions.
So as we were talking, the group of ministers that has been constituted for the purpose of combating and monitoring coronavirus, there was another meeting today. What are the major recommendations or developments?
No, you see, in the group of ministers, we update the group, the health ministry. We tell them that what's the latest situation, what's happening, in fact, all of them are involved in some way or the other. Like there is the external affairs minister, who is of course involved in a big way what's happening outside India. Then there is a civil aviation minister. He is involved with all these flights and all instructions to passengers, handling things at the airport. So they are all. Home Ministry is helping us in coordinating at the borders, porous borders with Nepal, with all the states. Defense Ministry is also helping us with all that quarantine thing that we have done for those 645 passengers that we brought back from China and other. You see, Pharmaceuticals Ministry, the minister is there. The shipping minister, incidentally, is the same person. So there is helping us in coordination at the this thing, airports, etc. My own colleague minister in the health ministry. So it's like all of them are part of the whole thing. We keep talking to each other almost daily, and the health secretary keeps talking to all the secretaries of the various departments on a regular basis. So today itself we had updated everyone about the latest situation, and if there was any suggestions that anybody could. So they have all said that they are also monitoring the role that they have to play within their own departments. They are also following with everything. It was a good meeting, good discussion, and it was quite reassuring that everyone is putting his heart and soul into ensuring that we don't allow the virus to come inside India and trouble Indians.
So let me shift the focus a bit to Ayushman Bharat scheme. Now on the floor of the parliament, you informed that the health ministry or the centre has given more than 3,500 crore rupees to the states in last 2 years. But 4 states, Delhi, Odisha, Telangana and West Bengal, haven't implemented the scheme. How are you planning to get these states on board?
You see, it's a federal system. I can't force them, but I can politely keep requesting them. The day I took over the charge in the health ministry this time, the first thing that I did was to call all these chief ministers of all these 4 states, and then also to write to them, then to pursue with them, then to send my officers there, then to have detailed discussions with the CEO of the Ayushman Bharat, with their senior officers. So we continue to do that, and one day I am sure that ultimately they will appreciate that it is not in the larger interest of the poor people in their own states, because after all this is a scheme which is being watched all over the world. The United Nations invited the Prime Minister to talk about universal health coverage. It's probably the most ambitious program of the whole world in the health sector, where you are in fact in a country of 1.35 billion people, you are helping 56 crore people individually, and taking care of their big illnesses. So for these 4 states also, they also have to appreciate that for Ayushman Bharat, a significant chunk of the money is given by the central government. So they are in fact depriving their poor people of the support of the central government for giving them the facility in almost over 20,000 hospitals in this country, with the portability factor there. Anyone in those states, if say somebody in Delhi, if he was a part of that group which enjoys Ayushman Bharat, and if he falls sick in say another state, if he falls sick in say Bangalore or maybe Tamil Nadu or any other place, he can walk in any hospital there, which is an empaneled hospital, and the list is quite big, more than 20,000 hospitals now. So he starts getting the treatment even if he doesn't have a penny in his pocket. So these governments have to ultimately appreciate that they are depriving the poor people of their country, of their state, by denying this. I think it's not fair to the poor people. The states have to ultimately realize that there are few issues where you have to rise above politics. It's not about the Prime Minister or anybody else. It's the scheme may be called as the PMJ, but it doesn't have it doesn't have political connotations. It is for the poor people. I have myself interviewed many people who got the benefit of Ayushman. They call Narendra Modi a Messiah. They compare him to God. They say if he was not there and if this scheme was not there, we wouldn't have been able to save my wife or my husband, or for that matter any family member, because they don't have the money, they don't have a house to sell to take care of their high profile treatments, for say cardiac surgery, for orthopedic surgery, or for brain surgery, or for anything which is beyond their treatment capabilities.